So I wasn't there Monday, so I'm gonna try do this as best as I can from watching the short video and reading the document. My dog is also in the room, so you might hear him, his leash jumping around. Um, but the first question is, which demographic of patients is most represented in a clinical site, and why do I think that? Um, I mainly, for the sport I do and the time I go, a lot of them are getting ready for the practice. I mainly see Hispanics of some sort or white males or white females. Um, those are the most common I see when I work there. And why do I think that is? It's probably just because of their practice time. Because a lot of them, when I go in, they're just getting ready for practice. They come and get their ankles taped and whatnot, and they go to the practice. I'm not there in the morning. Even on Thursday when we don't have classes, I'm not there in the morning. I'm there in the afternoon, and that's still the same group I see is mainly them. And the people that come in, they try to be, because on the document it said like uh, overall health, like if they're trying to be healthy and stuff like that. Um, you know, see them often, or like if they're in good spirits, or like if they are in a quote unquote better off family, like where money is not an issue. Um, they are typically healthier. So the people that usually come in, it's kind of like that stereotype we talked about last week. Is if they don't have money, they're always gonna be hurt. Jeez, dog, you're okay. Um, it's that's what I think it truly is. But that's mainly what I see is just the Hispanics and the white people, and um, I don't think anything differently of it. I just think that just because of the practice time, that's what I mostly common. Um, and the second question kind of leads into the second question. Are there any identities or groups that are missing from organization? Um, I rarely see African Americans in, maybe because they are in class, or they come in the morning, or maybe if it's like a freshman or something like that, maybe like a freshman female, or even a freshman male. Jeez. Or even a freshman male. That there he is. Even a freshman male. Come in. Um, come in. They might be a little timid or scared just because it's mainly the whites that I see that come in, especially the time I come in. And with the Hispanic group, maybe they're forced to come in to make sure like they get safety. But if it's if they don't come in, they might be a little timid just because of the certain population, and with Iowa not being very diverse, maybe they just feel a little timid about that. And then the third, jeez, the third question is, what intersections might your patient population represent without you knowing? How can you become more inclusive and knowledgeable of the intersection to improve patient care? Um, I think just like looking around is looking at different cultures and getting them like their background information of what type of culture they are. Some might be Muslim that we don't know. There was a study in student leadership that, I don't want to get the number wrong, so I'm gonna get a range. Like it's like 40 to like 60 students last year were Muslim, so it's not a big Muslim population. So they were the strong, brave enough ones to come out saying they're Muslim. So it might be that we don't really know their culture enough, and that's just one that really stuck out to my mind, um, just because it's just a small number, or even like their gender identities. Some might be gay that that are afraid to come in, and just knowing to take proper care of them compared to everyone, to make it this the atmosphere feel more welcome, to have them come in and not be afraid of the athletic training room, since it is a very safe space area. And to improve it is to make it a safe space to talk to the patients about what's going on, and like how we take care of them, how we want to get them to know them, not only about their injury, make sure they're back to their sport, but also on a personal level, just because if they do come in with another injury, they feel a lot more confident and less worried about, will they mess up, will I still get hurt again, or whatnot. Um, but that's the gist I got off of the short document and the short video. So hopefully that answered every question. But overall, I just thinking just being a safe space for everyone, um, to make sure every patient is cared for. They'll have more confidence to come in and to come back to you and to come back to the facility. Thank you for listening.